As I bring you my third video message, I'm hopeful that everyone in our School of Medicine's community is staying both healthy and productive. We find ourselves in a very challenging time. Many of you are continuing to work on the front lines, whether it is to provide critical care to patients, continuing vital research on COVID-19, or working remotely to further our mission areas. Thank you for your dedication. We're very fortunate to have our Instant Command system leading us in these efforts, as they have done since they began preparedness planning back in January. On the direction of David Marcosi, Associate Professor of Emergency Medicine, and Dr. Gregory Schrank, Assistant Professor of Medicine, the Instant Command system has done an outstanding job of coordinating with UMB President Dr. Bruce Jarrell, the University of Maryland Medical System President, Dr. Moen Suntha, and the University of Maryland Medical Center President, Ms. Allison Brown, and myself as Executive Vice President of UMB and Dean of the School of Medicine. Since my last video message to you, there has been a number of important developments related to the coronavirus health emergency. Confirmed cases and deaths continue to increase, even as we take drastic steps to limit our contact with other people through social distancing and self-quarantine. Last week, we learned that a member of the University of Maryland Baltimore community has tested positive for the virus. This week, Governor Hogan extended the closure of public schools until at least April 24th and closed all non-essential businesses in the state. As a member of the COVID-19 Response Task Force, Dr. Wilbur Chen and Dr. David Marcosi are actively advising Governor Hogan on the state's response. The university has elevated its response as well, transitioning from moderate research restrictions to severe research restrictions. Under the severe restrictions, investigators are expected to curtail all activities not critical to maintaining animals, unique reagents, cell lines, and essential equipment. Specific laboratories associated with COVID-19 research will remain open so that critical research to fight the pandemic can proceed. Steps are being taken to accommodate a projected surge in coronavirus patients and to continue the vital research necessary to fight the pandemic. University of Maryland Medicine, working in cooperation with Johns Hopkins, will operate a field hospital at the Baltimore Convention Center. Every effort is being made to expand hospital beds statewide. Please visit the School of Medicine's comprehensive coronavirus website, which include links to the latest official UMB letters from President Jarrell, as well as School of Medicine specific information regarding the elevated policies. School of Medicine faculty experts continue to make high-profile appearances in the national media, educating the public about the virus, self-protection, and antiviral therapies and vaccine development. Much work is being done by members of our academic community to focus on the COVID-19 pandemic. Dr. Mohammed Sajadi, Associate Professor of Medicine and researcher at the School of Medicine's Institute of Human Virology, has been studying how the spread of COVID-19 is affected by weather. Using weather modeling, the team found that the virus spreads more easily in cold, damp climates, which could predict where future outbreaks around the world could occur in the coming months. Under the leadership of Dr. Steve Zinn, the Reuben and Violet Gigi Professor and Chair of the Department of Pediatrics, the department itself has launched a new national website called Kids and COVID-19. The website, developed in conjunction with the American Academy of Pediatrics, is a resource for pediatricians and parents. Dr. James Campbell, a professor of pediatrics, is spearheading this initiative. Dr. Robert Gallo, the Homer and Martha Gudelski Professor in Medicine and Director of the Institute for Human Virology, helped to facilitate the delivery of 1,000 coronavirus tests to Baltimore. These tests were donated by a company in China and will be distributed through the State Health Department. Dr. Tracy Bale is investigating the health toll of stress on fathers brought on by the COVID-19 pandemic. We continue to operate under the Step 2 of the university's policy to fully protect faculty, staff, students, and patients. All but essential employees are working from home. All in-person administrative meetings and events, including gala and alumni reunion, are canceled. In-person commencement and school graduations are also suspended for this year. I urge you to stay at home unless it's absolutely necessary to go out. It is critical for everyone to follow all the state and federal laws and CDC guidelines that are now in place, which restrict travel and promote social distancing. I want to encourage each of you to use this time when you're working remotely to advance the mission areas of the School of Medicine in any way possible. I'm convinced that if we focus on these priorities, when we resume our normal schedules, we will realize that there was little or no time that was lost. In closing, I want to reinforce my points of encouragement and extend my sincerest best wishes to each of you to remain healthy and optimistic. I'm confident that each of us can continue to demonstrate the courage and the relentless spirit that I have seen countless times in the School of Medicine community when we are faced with adversity. Thank you again for everything that you do in and for the School of Medicine.